Allergy is one of the most common health complaints. More than 1 in 5 Americans suffer from some form of the condition, and unfortunately, the natural world abounds in allergens, the substances that trigger allergic reactions. Ironically, it's our own immune system, which usually protects us from infection, that's responsible for these reactions. When we're exposed to an allergen, our body produces an antibody called IgE. IgE's day job is fighting off parasites, but during an allergic reaction, it mistakes the otherwise harmless allergen for a bad guy. It attaches itself to special blood cells called mast cells, which the allergen also binds to. The mast cells then release a chemical called histamine into the bloodstream, and this is what causes the classic allergy symptoms. Itchy eyes, rashes, runny nose, and of course, you know what I mean. Mast cell concentrations are high in the airways and the intestines, which is why symptoms tend to be localized there. Pretty much anything can be an allergen, and susceptibility varies from person to person. Among the most common are pollen, mold, insect bites, dander from domestic animals, and specific foods like shellfish, nuts, and wheat. Allergies can also exacerbate existing conditions like asthma, a shortness of breath caused by inflammation of the airways. Severity of symptoms ranges from mild discomfort to anaphylaxis, which is the most serious form of allergic reaction. Symptoms of anaphylaxis include swelling, hives, difficulty breathing, and tingling in the skin. It can be life-threatening, so if someone you know to be allergic exhibits these symptoms, seek medical help immediately. You may be familiar with the EpiPen, a medical device which allows a patient to administer his or her own emergency treatment in the event of a severe allergic reaction. EpiPens can save lives, but can be dangerous when used incorrectly, so ensure that you've been adequately trained before handling one. Because allergies have been around for so long, they're relatively easy to diagnose. The most common method is a skin test, where patches of the patient's skin are exposed to specific allergens and monitored for reaction. Elimination tests involve removing a potential allergen from the patient's environment or diet, then reintroducing it to see if a reaction is triggered. Being allergy-prone is genetic. If one of your parents is allergic, you have a 50% chance of inheriting the condition. If both your parents are allergic, this chance rises to 75%. What about treatment? Well, the most obvious solution would be to avoid the allergens. But in the real world, this can be tricky. Ever tried hiding from pollen in the spring? Or talking a bee out of stinging you? So there are other options. Antihistamines can be effective against most allergies, including hay fever, and are available over the counter. If you're allergic to insect venom, wearing long sleeves and gloves can lower your chances of being stung or bitten. Insecticide and scented cosmetics are also effective. Allergies aren't going away anytime soon, but now that you're informed, you can treat them before they get you. Bad joke.